from the Aster Pediatric team and myself Dr. Sindhu.
I am Dr. Nanditha.
We are Paediatric Intensivist at Aster RV Hospital. Today we are talking on a very exciting topic, that is the Summer Maladies in children. So what is Summer Maladies? This time Bangalore is especially hot. So let's see and discuss what are the problems that are associated with this summer season. As in the summer holidays, the children are free and they are exploring all around. With their curiosity, they are more prone for injuries also. So what are the injuries they can have? It can be a mild abrasion to a major accidents like fall from the height, especially from a second floor building or from a very tall height of the buildings, which can be a detrimental and life threatening. So what all things we can do? If you find just abrasions, all you do is clean the wound and apply any antiseptic. If there is a laceration, that means if if the wound is too big or there is a profuse bleeding, please consult your doctor. If the child has any fractures, especially, how do you know it is a fracture? Because one, immediately that whichever the area that bone is got fractured, that area will get swollen, there will be excruciating pain, and the child will not be able to move that particular limb. So these are the signs of a fracture. Whenever you notice this, immediately immobilize that particular joint and get to the medical attention. The most detrimental of all these are injury to the head. So whenever you anticipate a child who has injury to the head, especially while playing or something, any reduced consciousness, that means after the child has fallen and got hit to the head, if the child is excessively sleeping, or you find the child to be vomiting more than 2 times or 3 times vomiting, or any abnormal movements, it could be just a staring look or any seizure, that is the fits, what we in a common layman's term what we call is a fit. If anything, these things are there, that is an indirect sign that child could have bled inside the brain. So you have to get the child to the doctors immediately, because this is life threatening and immediate intervention has to be taken care.
To add to this, we also come across children who are very actively playing in the park, and sometimes fall from the equipments can result in similar symptoms. And nowadays we see children enjoying their bicycle rides. Most of the time we appreciate parents taking care of the child's head injury, especially they'll be wearing a helmet. But it's just not sufficient sometimes, because bicycle bar handle injuries are very common these days. Because the handlebar is very close to the abdomen, they will end up having tummy injuries. We might come across children having very severe tummy pain. Sometimes a very major internal bleeding can be happening, which is life-threatening. They might have tummy ache, cool peripheries, altered sensorium, poor urine output. All these major symptoms need immediate medical attention. Apart from falling from the height, nowadays we are also seeing children where they are drowning in the sumps. So it is important, as socially we all take care of our children for the future generation.